Hello, my name is Caitlin McDonald with the Orange County Shrinks. OC Shrinks is a mental health, digital space, and networking group that believes the best way to uplift professionals in the field is to provide space for connection, collaboration, and community. Today, we have the pleasure of interviewing Megan Roy with Rogers Behavioral Health. Megan is a licensed marriage and family therapist who has worked with Rogers Behavioral Health Los Angeles since their grand opening in December 2019. As a local herself, Megan has served the Southern California area for the last 7 years. She has provided therapy to adults, children, and families in diverse communities from Los Angeles to Orange County. Megan has experience working with clients from varied cultural, ethnic, and socioeconomic backgrounds in multiple levels of care. She is currently treating patients with OCD, anxiety, and depression at partial hospitalization and intensive outpatient programs, though she has also experience working with trauma, behavioral problems, and other anxiety and mood disorders. Megan is proud to be a therapist at Rogers Behavioral Health as she continues to fill her passion for bringing positive change and wellness to the lives of others. So welcome, Megan.
Thank you so much. It's my pleasure.
Great. So Megan, to start off, why should someone choose Rogers?
Great question. Yeah, first and foremost, Rogers has been providing mental health treatment for over 110 years. And since that time, the care of our patients has been our top priority. So as a result, we can confidently say that our patients get better. Rogers treatment works, and it's backed by outcome assessments that are completed by patients throughout their time in treatment with us. In addition, our patients have access to a multidisciplinary team, and that includes a psychiatrist, a nurse, a mental health clinician such as myself, and more depending on the needs of the patient. We also have a continuum of care in order to accommodate patients who may need different levels of treatment and support. So this includes intensive outpatient, partial hospitalization, residential care, inpatient care, and we even offer support groups for our patients after they discharge as well.
Wow, what a diverse level of care that you offer.
Yes.
Can you please describe some of your programs at Rogers?
Yes, I'd love to. So we have programs for both adults as well as children and adolescents. And at both our San Diego and Los Angeles facilities, we currently offer our OCD and anxiety program, as well as our depression recovery program. And in each of these programs, we have both partial hospitalization treatment, and that is 6 hours a day, 5 days a week, as well as intensive outpatient treatment. And this is 3 hours a day, 5 days a week. During program hours, patients meet with their individual mental health clinician multiple times throughout the day to receive support, gain psychoeducation, have opportunities for skill building, as well as to assist them with their assignments for the day. So for the OCD and anxiety program, these assignments primarily consist of exposures through the use of exposure and response prevention. And for the depression program, their primary focus is on behavior activation assignments for depression. Patients also attend group therapy, and they meet with their psychiatrist 1 to 2 times a week as well.
Great, great. And what sets Rogers treatment programs apart?
Yeah, so in addition to some of the things I've already mentioned, such as offering multiple levels of care, the use of our outcome assessments to monitor and adjust treatment, our multidisciplinary team approach as well, I think it's important to really discuss the core component here, which is our treatment. Specifically, all facilities across the Rogers system use evidence-based care. And what this means is that the treatment we use has been proven to be effective through the use of scientific evidence and extensive research. Now, while there is this standardized care throughout the Rogers system through the use of these evidence-based practices, our treatment is also highly individualized. So each patient is individually assessed by each member of the treatment team to get a real comprehensive understanding of what their needs are while they are under our care. And after our initial assessments, we work with each patient individually to create their treatment plan, which is heavily focused on the collaborative creation of their hierarchy. And this treatment concept is used across all of our programs. And doing this really allows us to ensure that each patient is being treated for their specific symptoms and needs.
Great, great. And you mentioned the clinical outcomes that have been demonstrated. How have they demonstrated Rogers' quality of care? Can you talk a little bit more about them?
Absolutely. Yeah. So we take our clinical outcomes quite seriously at Rogers. On the first day of treatment, patients are given a battery of tests to complete, and that assesses their current symptoms and their current level of functioning. And what we do is we continue to administer these assessments regularly throughout their time in treatment. So this helps us to identify the progress they're making, as well as to be able to look at areas of their treatment that maybe we need to take a little closer look at and then adjust their treatment plan accordingly. And it's such a benefit because we're able to do that in real time as soon as we get these assessments back to us throughout their time in the program. And patients also take these outcome assessments at discharge as well. So we really use this data to ensure that our patients are getting the most effective care possible, and we use statistical analysis of the data to do so. And we're able to identify and replicate treatment approaches that ultimately get the best results, not just in the local Southern California offices at Rogers, but across our entire system. And when looking at this data, we can see that progress is made and their overall level of functioning increases after completing our treatment.
That is so powerful. Thank you for sharing that. Now, just a quick question for a lot of the folks who will be watching this. Does Rogers take insurance?
We do. So we do have in-network contracts with multiple insurance companies. This includes Anthem, Cigna, Magellan, MHN, United. And we also have a pretty good success rate with getting acceptance of a single case agreement as well.
Wonderful, thank you. And then lastly, Megan, what additional programs does Rogers offer?
So nationwide, Rogers facilities offer a variety of different programs. This includes eating disorder treatment, specialized treatment for patients with autism spectrum disorder, trauma, addiction, emotion dysregulation, and other mood disorders. And that depends on what Rogers facility that you're taking a look at. As far as the closer offices of Los Angeles and San Diego, we currently offer OCD and anxiety as well as depression recovery, and we are growing, so we will be offering new programs very soon.
Great. Thank you so much, Megan, for sharing this great, valuable information that dives in a little bit more into what Rogers has to offer and the extensive programs that you have with the clinically backed outcomes as well. It truly has been a pleasure, and thank you, Rogers, for your sponsorship of Orange County Shrinks as well.
Thank you so much for having me. I really appreciate it.
Great.